today we're going to talk about our One Health projects in the DRC. So first I will start by a bit presenting the settings because it's quite a challenging and complex setting. So we are working in the Kahuzi-Biega National Park, so situated in between South Kivu, North Kivu and Maniema. And so we are working mainly in a, where it's a really interesting settings, rich of biodiversity, but also threatened by destruction, so anthropological destruction, but also climate change. So it's also an interesting settings because there is ongoing conflicts, ethnical conflicts, and also it's driven by widespread poverty. And all the dynamic existing on this park make us believe that we could try to operationalize a One Health project in the park. So just quickly, as a small definition for people that are not aware of what's One Health, so it's a multi-sectorial approach, an integrated approach that shows the interconnection in between human, animal, and their ecosystem, human-animal health, and the health of their ecosystem. And it's a multi-sectoral approach that reunites all levels of the society, disciplines, and communities. So in these projects, in order to create this multi-sectoral approach, we didn't work alone. We as Doctor of the World, a health organization, worked in collaboration with an animal health organization called Veterinary Without Borders and a local environmental health organization called ADMR. So our approach based on One Health aimed to be decolonial, like based on rebalance the knowledge system, but also increase the community resilience. I can do it, yeah. So as the One Health framework can work on many levels of the society, we decided to work on the more local level, so the community level. And to do so, we decided to implement participatory action research projects in order to work together with the community.
So to talk about the knowledge systems you were just referring to before, we decided to implement this kind of methodology. So I don't know if you guys are familiar with this method. So it's basically a collaborative method. And in this case, we basically partnered with communities to do our own kind of research. And as opposed to traditional research, which is more maybe exploitative or extractive of local populations, here we kind of work together. So the advantages of participative action research is that first, it allows for inclusivity, empowerment, and ownership of communities for the projects. It allows for action, so you have, at the end, you end up with practical solutions with immediate impact and relevance because communities will kind of design their own solutions. And lastly, it allows for a rigor and a systematic way of doing things because it's research. And so you generate new knowledge. And as I think someone said before, generating knowledge is also a form of gaining power or maintaining some power. So yeah, this is kind of why we decided to use this method. The next one. So the theme of this session was to talk about how being decolonial, having a decolonial approach. So as I said, we tried to understand where we were in terms of the knowledge system. So of course, AkiDwA was telling us about One Health, and in the One Health approach, usually you have scientific knowledge, you know, about disease transmission, and then you have the local knowledge where communities are, and then this is difficult to make sure that in your project, those two knowledge systems are actually at the same level. So this is why we wanted to do, so to question the dominance of the knowledge system created in the global north that usually transferred in the global south. So we thought, okay, how can we make sure that local knowledge systems about disease transmission or beliefs or cultural way of doing things are not misconstrued or ignored because they have an importance, because it's still knowledge. So yeah, the focus of our project was to value local epistemologies and knowledge systems. I guess, yeah, maybe for the ones who are not familiar with knowledge systems, there are many authors that talk about how we produce it and the importance of incorporating locally created knowledge in research, so it's more rich. I can give you authors that we used to do this project. Now we'll let Kridzia talk a bit more about implementation.
So maybe I just realized that I forgot to talk about like the branches of the One Health that could be considered. Like, so Fanny like mentioned the transmission of zoonotic disease. There is of course many domains where we can exploit in One Health, like antimicrobial resistance or also food security. But obviously, like Fanny also already mentioned, we are working mainly here on this project on the transmission of zoonoses. So the disease that are transmitted from animal to human or the other way around. And so at first we really aim to work on a local level, and there included to the participatory action research we try to also include actually the loop of social communication behavior change, where we try really to understand why the communities are having behavior that actually can be dangerous for their health, and try with them to find solution to how to stop the spillover of zoonotic disease, because we are in a park where, like, yeah, COVID-19, I think everyone know it and everyone heard about it, how animals and the closeness of human to animals can create and generate, I mean, can lead to the emergence of diseases. So the aim is really to understand with the community why they do it, but not only why they do it, but what are the solutions that can be sustainable for them in order to prevent this transmission of zoonotic disease. On the same way, we try directly to work with the health professionals, so human, animal, and environmental health, and to reunite them together and coordinate them, like through coordination platforms, like communication platforms as well, but also through monitoring system, because right now all monitoring systems are really in silo. Like, one exists for the human health, one exists for the animal health, and still in some places it doesn't even exist, and also for the environmental health. So here we aimed with the two other NGOs that work with us, like to try to reunite all those level of health together, to have a better coordination. And then on a more upper level, we try also to advocate. And in our case here, it's still quite a low level, the advocacy, because we work on a provincial level, where actually in DRC, One Health committees are already created, and they are structure created by governments, but they are not really animated. So they are created, they are there, but they are not acting. So the aim is like, with the project here, we animate the structure first, but then we bring them back to the community level and try to really like make this cross-sectoral work all together. Just before going further, I wanted to introduce a concept that maybe had been introduced already also before slightly. It's the fact that the global south actually are where the most vulnerable people are, and it's also the place where we ask the people to make the most efforts to reduce, like for instance, the impacts of climate change. But those people are living in a cycle of poverty already. So if we remove the climate change, that's what's happening now to everyone, those persons that live the closest from the most biodiverse settings, we ask them to make the most effort to prevent the spillover of disease. But their second cycle of poverty with more vulnerability, with no access to healthcare, with violence, with no access to education. There is, of course, gender inequalities. We already talked about it in the previous session. But also they are in a continuously stress of their environment being destroyed. So there is a lack of resources, a decrease of livelihoods, and all of this make that the climate change come and amplify all this cycle of poverty, and people will adopt behavior that actually are dangerous for their health, but they don't have choice to adopt those behavior because they need to survive on that setting. And so they will not think about the consequences of, okay, what I'm gonna eat today, I need to go and hunt because I need my level of protein of the day. So the hunting, but also the deforestation, because for instance, we are in a setting where there is a lot of deforestation to sell charcoal to the biggest city, lead to being closer from animal and so to the transmission of zoonotic disease. And those zoonotic disease cannot be preventable first, but cannot be healed neither because we are in the cycle of poverty where they don't have access to health care. Also, this ongoing stress on the resources leads to migration and to lead, of course, to more conflicts in between population. And so that's why we do believe that first the One Health approach is really important, and to consider the problem as synergy existing together rather than different problems together. But also we do believe that working with local community to find a solution would lead to a more sustainable solution.
So I'll go through a few recommendations that we have going in the first phase of our project. So as Kritsi said, address social hierarchies to ensure an equitable environment when producing new knowledge about these issues. Integrating decolonial methods or approaches in the way we go about this kind of projects. Secure sustained support, as she said, making sure that you have local structures that can take over the work that we've started. And then ensure multisectorial collaborations. These recommendations, of course, don't go without challenges. So the first one is the multisectoral approach. It's very hard to have animal health and environmental experts work together because sometimes they don't speak the same language or they're just used to work in silos, so it's difficult to make them work together more than once on the long term. And as I said, when we leave this area, hopefully they still work together. Secondly, to address social hierarchies is very difficult, especially inside communities as well. You also have social hierarchies. For example, in some villages indigenous people were less heard, women were less heard or less represented in conversations, and that was difficult to address, even if we were aware of it. In our area as well, the past aid influence was massive. So you have decades and decades of material supports that were given in this region. And so, of course, Médecins du Monde, doctors of the world coming in, of course, they were expecting a lot of material support or medical support that we were not going to give them because it wasn't the aim of the project. And so that was a very big challenge to overcome. And lastly, to re-examine power imbalances throughout the whole project is very challenging as well, because you have to question yourself, like you said in your previous presentation, question yourself, question your positionality all the time, and that's a challenge. It kind of slows you down a little bit. So I'll leave you with a few take-home messages. So the importance of the One Health approach, so the collaborative approach, of course. Utilizing participative action research is definitely, for us, the key to finding innovative, sustainable solutions to One Health issues, whilst staying very reflective in the way you go about things. And lastly, as she said, precarity, vulnerability needs to stay at the forefront of discussions when we address One Health issues. And that's kind of it for our presentation. Thank you very much for your attention.